Have you ever wondered if the way you talk to your doctor might actually be harming the medical care you receive? Many older adults go through this without realizing that how we communicate during a medical appointment can make all the difference. I'm not talking about using sophisticated medical terms or knowing every detail of your clinical history by heart. I'm referring to small everyday conversational habits that, unintentionally, can work against you. The truth is that the words you choose, the tone you use, and the way you express your concerns largely determine the quality of medical care you get. And here's what most people overlook. Doctors can only work with the information you give them. If that information isn't clear, complete, or direct, even the best specialist can miss something important. This isn't about blaming you or making you feel like you've done something wrong. Most older adults have developed these habits over time. Many come from a lifetime of trying to be polite, not wanting to complain, or assuming certain symptoms are just normal signs of aging. But when it comes to your health, those small conversational patterns can have big consequences. You might miss out on treatment options, delay a key diagnosis, or leave the appointment without really understanding the next steps. In this video, we're going to explore the 5 uncomfortable truths about how older adults sometimes speak during medical appointments. Habits you might be repeating without realizing, and that can quietly harm your health. We'll look at how these patterns show up, why they happen, and what you can do instead to make sure you're truly heard, respected, and cared for the way you deserve. Stay with me until the end, because the last point is something even the most careful and thoughtful patients often get wrong. And fixing it can completely transform your future appointments. Number 1. Downplaying or minimizing your symptoms. One of the most common mistakes I see in older adults during doctor visits is downplaying or minimizing their symptoms. It sounds like, "It's nothing serious, just a little pain," or "I don't want to make a big deal out of this." You think you're being considerate or that you don't want to waste the doctor's time, but in reality, you're making it much harder for them to help you. Doctors need precise details to piece together the puzzle of what's really going on. If you leave out information or make a symptom sound less serious than it is, you're handing them an incomplete puzzle and expecting them to see the full picture. For many older adults, this habit comes from years of putting others first, wanting to appear strong, or simply not wanting to seem like a complainer. I've spoken with friends in their 70s who told me they endured discomfort for months because they didn't want to bother the doctor. But here's the key. What feels like just a little pain to you could be an early sign of something much more serious, but also much easier to treat if caught early. The longer you wait or the less you say, the greater the risk that the problem becomes serious. I remember my neighbor Helen, 78 years old. She had been feeling constant pressure in her chest for weeks, but dismissed it as a sign of age and only mentioned it casually during a routine checkup. Only then did the doctor suspect a heart issue. Tests confirmed she needed immediate treatment. Later, she told me that if she had kept minimizing or staying quiet, she might not be here today. Her story is a powerful reminder. What seems small to you can look very different to a trained professional. The best approach is to describe your symptoms exactly as you feel them, without softening them to make them sound less important. If you've had pain for 3 weeks, say so. If your sleep is interrupted, explain how often. If it affects your daily life, be honest about how. This isn't complaining. It's giving your doctor the tools they need to do their job well. You're not asking for pity. You're providing facts so they can help you stay as healthy and independent as possible. When you speak openly, you take control of your health in a respectful and effective way. A good doctor will value your honesty and use it to guide your care. Remember, the appointment is your time. Don't waste it by hiding how you really feel. Number 2, speaking vaguely or unclearly. Another habit that causes a lot of problems in medical visits is using general terms instead of giving clear, specific details. Many older adults say things like, "I feel off," or "it hurts a little," without explaining when, where, or how it happens. While those phrases make sense to you, they leave the doctor guessing, and guessing in medicine can be dangerous. The vaguer your words, the harder it is for the doctor to identify the cause, which can delay diagnosis or even send them down the wrong path. One common reason is that we often forget to keep track of symptoms. By the time we reach the appointment, everything blends together, and we end up giving a short, fuzzy description. Another reason is habit. In everyday conversation, vague language is enough for family or friends to understand us, but a doctor needs precision. They need to know exactly how long you've had the symptom, what triggers it, how intense it is, and what makes it better or worse. Think of my friend Robert, 81 years old. Once he told his doctor he had been feeling weak lately, and that was all. The doctor asked some questions, but since Robert couldn't remember whether the weakness came in the morning or afternoon, whether it worsened when walking, or if there were other symptoms, there wasn't enough to go on. Weeks later, when it got worse, further tests revealed anemia that could have been treated earlier. Robert later admitted that if he had been more specific from the start, he could have saved himself those weeks of exhaustion. The best way to avoid this mistake is to prepare before the appointment. Write down your symptoms, when they started, how they feel, and what affects them. If it's pain, describe it. Is it sharp, dull, burning, or throbbing? If it's fatigue, does it come after eating, in the morning, or only after physical activity? This level of detail not only helps the doctor understand you better, but also speeds up the right tests and treatment. When you give precise information, you're not being difficult. You're helping the doctor connect the dots. It's like giving them a clear map instead of a blurry sketch. And when your health is on the line, clarity is one of the most powerful tools you have. If these points are resonating with you as you watch this video, write number 2 in the comments so I know you're here. And if you haven't already, subscribe and hit the bell. Your support helps us keep creating content that informs and inspires. Now let's continue. Number 3, not bringing a written list of concerns. One of the biggest missed opportunities I see in older adults is arriving at the appointment without a written list of what they want to discuss. You think, I'll remember everything once I'm there. But the reality is that once you're in the room, it's very easy to forget half of what you had in mind. You might get caught up talking about one main issue, or the doctor might ask questions that steer the conversation elsewhere. Before you know it, the visit is over and you leave realizing you forgot to mention 2 or 3 important concerns. This isn't about being forgetful. It happens to everyone, especially when the appointment feels rushed or you're trying to recall details on the spot. But without a written list, you're leaving your health to chance. Doctors aren't mind readers. If something doesn't come up in conversation, they won't know they need to address it. I've seen friends leave appointments still worried about the same issues they came in with, simply because they never got around to mentioning them. I remember my friend Margaret, who went to talk about her blood pressure medication. She had also been having trouble sleeping and occasional dizziness for a while, but when she left, she realized she had only talked about the medication. Weeks later, the dizziness worsened, and it turned out they were related to her blood pressure control, something the doctor could have connected earlier if both concerns had come up together. That delay cost her time, energy, and extra clinic visits. The best approach is simple. Before the appointment, sit down and write all your concerns, big or small. Number them in order of importance. When you arrive, hand the list to the doctor or keep it in front of you so you don't forget anything. Even if there isn't time to address everything in one visit, at least the doctor will know they exist and can help you prioritize. Going into a medical appointment without a list is like going to the supermarket without knowing what you need. You almost always forget something important. But with a list, you take control, make the most of your time, and ensure every concern, question, or change in your health gets the attention it deserves. Number 4, assuming the doctor remembers everything about you. Another habit that quietly harms many older patients is assuming the doctor remembers every detail of your medical history from previous visits. Even if you've been with the same doctor for years, they see dozens of patients every day. They may remember the big picture of your health, but they won't have every test result, past symptom, or medication adjustment memorized. When you assume they already know everything, you might skip important updates or changes, creating gaps in your care. I've seen this happen countless times. My friend Walter went to his regular doctor complaining of joint pain. He assumed the doctor remembered his history of gout and didn't mention that he had started a new blood pressure medication a month earlier. That detail was key. The new drug was contributing to the symptoms. Because Walter didn't say anything, they spent weeks doing extra tests to figure out what could have been resolved in minutes. The truth is that medical records help, but they don't tell the whole story. There may be notes from the last visit, but they won't include everything you've experienced since then. And sometimes your file is so long that the doctor can't review it page by page before you walk in. If you assume they already know the latest details, you risk leaving out exactly the information they need to give you the best advice. The best habit is to give a quick, clear update at the start of every appointment. Mention any new medications, supplements, or lifestyle changes since the last visit. If you've had new symptoms, even if you think they're unrelated to the main issue, include them in that update. A simple phrase like, "Since my last visit, I started this medication and I've noticed these changes," gives the doctor a much stronger starting point. Think of it like catching up with an old friend. You wouldn't expect them to know what's happened in your life if you never tell them. Your doctor is your health partner, but the collaboration works best when you keep them fully informed. The more complete the picture you give, the faster they can connect the dots and guide you toward the right care. If these points are resonating with you as you watch this video, write number 4 in the comments so I know you're here. And if you haven't already, subscribe and hit the bell. Your support helps us keep creating content that informs and inspires. Now, let's continue. Number 5. Talking too much without letting the doctor guide. When you finally get into the exam room, it can feel like your one chance to say everything you've been thinking about for weeks or months. Many older adults want to make the most of that moment, so they start from the beginning and go through every detail, from what happened years ago to every little discomfort they've felt since then. While this comes from wanting to be thorough, it can overwhelm the conversation, use up the limited time, and prevent the doctor from focusing on what really matters right now. Appointments are usually short, and doctors are trained to guide the discussion and get the right details in the right order. When we fill the air with too many side stories or unrelated symptoms, we unintentionally derail the visit. Imagine a car trip where the GPS is trying to take you to your destination, but you keep taking detours to show every interesting place along the way. You might never get where you need to go. I remember my friend Mary, 77 years old, who went to talk about knee pain that was making it hard to walk comfortably. By the time she finished telling the doctor about her cousin's hip surgery, her gardening work, and the weather changes she noticed last month, half the appointment was already gone. They barely had time to examine her knee, and she left with more questions than answers. Not because the doctor didn't care, but because there simply wasn't time for everything. That doesn't mean you should hold back important information. It means letting the doctor lead with questions so your answers can be as relevant and helpful as possible. You can always bring a short list of your main concerns and hand it over at the start. That way you won't forget anything important, and the doctor can decide how to prioritize each issue. Another tip: start with clear, concise explanations. Give the main point. "I have sharp pain in my right knee when I stand up after sitting," and let the doctor ask for more details. This back and forth ensures the most urgent issues get addressed and leaves room for follow-up questions. Speaking in a focused, cooperative way shows respect for the doctor's process and gives you the best chance of leaving with answers, solutions, and a plan you understand. Remember, it's not about talking less. It's about talking in a way that works with the doctor's flow, not against it. Final thoughts. The way we speak during a medical appointment shapes the care we receive far more than we usually realize. Words can open doors to better understanding or create confusion that delays progress. As we age, the stakes feel higher, our health concerns weigh more, and every visit matters. That's why learning to speak with clarity, focus, and mutual respect is one of the most valuable habits we can build. It's not about becoming someone else or rehearsing lines. It's about being intentional with the precious minutes you have in that room. Think of it this way: your voice is the bridge between what you feel and what your doctor can help you resolve. If that bridge is clear and strong, the path ahead becomes easier to travel together. If it's cluttered with unnecessary details, mixed signals, or frustration, the journey slows down. Small adjustments, preparing your main points, letting the doctor guide the flow, and speaking honestly without fear can make all the difference. I've known older adults who dreaded appointments because they felt unheard or misunderstood, but I've also seen those same people transform their experiences simply by changing how they approach the conversation. When you leave an appointment feeling confident that your concerns were understood and addressed, That brings peace of mind that goes far beyond that visit. So the next time you sit down with your doctor, remember, you're not just a patient, you're an active partner in your own care. Your words, your tone, and your willingness to collaborate are powerful tools. Use them well, and you'll walk out of that room with more than just instructions. You'll leave with confidence, understanding, and hope for better days. Thank you for joining me today. I'd love to hear from you. Leave a comment sharing one thing that stood out to you and one small change you're going to try. Your words matter, and reading them motivates us tremendously to keep going. If this video added value for you, give it a like, subscribe, and share it with someone who might need it. Your support allows us to keep creating content that educates and uplifts. Thank you for watching, and I'll see you in the next one.